Welcome back to Experts.com, the Experts.com files. I'm Nick Rishwain. Today we're talking about the oncology failure to diagnose matter. So this is a cancer issue where somebody should have been diagnosed earlier and they were not. Thank you for voting, and let's get into the case. So this was a standard medical malpractice case. The attorney reached out to Experts.com, need an oncology expert to identify some of these things. Now, some of them are going to be weird to you, and others are going to be totally reasonable. But it was a failure on primary care and on an oncologist to diagnose cancer. The plaintiff went in for an MRI in 2009. The radiologist reviewed that report and they sent it to the primary care physician for follow-up. According to plaintiff's counsel, there was never any follow-up from the primary care physician based on this report from 2009. And then in 2011, the plaintiff was admitted to the hospital for what was initially assumed to be asthma, which turned out to be stage 4 lung cancer. So the attorney needed an expert for two things. First thing was they had to say that stage 4 lung cancer was fatal. And I know that seems weird, and I'm not and I think it's the likelihood of fatality. I think that's what they needed to establish. And then finally, they needed to say that this should have been caught in a primary care physician review of the MRI report from the radiologist. And that's the case. This happens a lot. Be the squeaky wheel with your primary care physician. Make sure you get answers on your reports. Failure to diagnose or delays in diagnosis are really common, unfortunately. Anyway, stay tuned tomorrow. I'll have the poll out for the next Experts.com files. Talk to you soon.